So let's talk about esophageal cancer. What are the symptoms? Symptoms are pretty classic. One is that you have difficulty in swallowing pretty much all the time, especially like chicken or meat, things like that. Difficulty in swallowing. Some people have weight loss. I never did. Or loss of appetite. Some people have heartburn that goes along with acid reflux. Also, hoarseness in your voice that's persistent and you've had it a while. That could indicate a symptom of esophageal cancer, or a chronic cough that you have. All of those things are little red flags to you to just think about what's going on. Who is at risk for esophageal cancer? Well, some of the people say that those people, just like most cancers, if you're a smoker, you use tobacco products, if you drink alcohol, or if you're obese, those classic things that with many cancers, it is a terrible risk factor for those things. So those are those four things. Also, in esophageal cancer, more men get it than women. So if you have those symptoms, how do you know when it's time to call the doctor? Well, let's talk about that. How do you know when to call the doctor and set an appointment? Well, if you've had persistent burning in your throat or heartburn for a long period of time, if you have difficulty in swallowing, just those symptoms we talked about, difficulty in swallowing, or if it takes a turn and more than having difficulty, there's a sharpness, a sharp pain or something, all of those things are a sign you probably need to go ahead and make an appointment. Why do we do that? Because the sooner, just like every other cancer, the sooner that it's diagnosed, the sooner they can treat it and hopefully do something about it. How does an esophagus turn into cancer? Well, I am a 100% layman. I have no medical information other than some of the things that I've read. And so we don't really know why certain people get it other than risk factors. Other than what happens is with inside the walls of the esophagus, evidently all that tissue gets irritated. The cells change, the DNA changes, and they become abnormal cells. They start multiplying really fast, and then they're crazy and they turn into a tumor. That's just my unprofessional response to that. However, I know that the sooner that you go and get information, have an endoscopy done, talk to your doctor, find out what you need to do. It may be just a simple, you need to take some acid reflux medicine, and that'll take care of it all. So be proactive in what you're doing. Now, next time, we'll be talking about the particular surgery that I had. And I don't know how to say it in the proper way, but it is a esophageal gastrectomy. So you might can Google that and see what it's about. But I'll tell you about it next time. Bye-bye.